We'll go ahead and get started. Purpose of this meeting is for this subcommittee to approve of the final recommendations from this subcommittee that will go to the full committee for their consideration on the 07 amended budget. Members of the committee, you have the tracking sheet with the proposed changes to the budget in front of you, and I will go over these and answer any questions if there are any. First change is on page 1, 17.0.2. I will come back to that item in just a minute. 17.0.3 is the first of a couple of three places that you will find that we funded 3 months worth of personnel. For some reason the department asked for 6 months in all these things, and not but 3 months in the rest of the year, so we decided we'd provide 3 months worth of funding throughout the document as it relates to positions. 17.0.8 Margie tells me is a number that the auditors say is the correct figure, and that's, as Larry Walker used to say, later data. I don't think it has no effect on this budget one way or the other, but it's just that the department requested that we reflect that number in the budget. Item 17.1.1, same thing on positions. Item 17.3.1 suggests that we provide new startup money, seed money for community health centers. As members of the committee know, and we talked about this at length, this is the federally qualified community health centers provide primary health care, and has turned out now to be pretty much the safety net in terms of providing health care in Georgia. There are over 100 different ones around the state. At the same time, there's a lot of areas of the state that are not covered by federally qualified community health centers. This is a major initiative on behalf of the federal government and President Bush's budget. We have been doing this in this body for as long as I've been here, and that is provide $250,000 startup money for these federally qualified community health centers. And as the committee knows, we discussed, once they get going, they by their federal charter are required to take all comers regardless of ability to pay. That mixture of income is from private pay, Medicare, Medicaid, and then if you don't have any money at all, on an annual basis, their operating deficit is funded by the federal government, with 20% of Georgians with no insurance. This is one of our suggestions as to how to play a part in dealing with that issue. Financially, in my time up here, it's the best deal going. You put up $250,000 one-time money, and then somebody else pays the rest of it. What I refer to as an all-American deal. You can see, and this, by the way, is the sites that were selected. The Georgia Association for Primary Health Care has a needs list similar to, I guess, the Regents when they request projects, and so it goes. This list comes right off their list, and it's a site in Alma in Bacon County, Macon in Bibb County, Lawrenceville in Gwinnett County, and Lakeland in Lanier County. $250,000 each. 17.3.2. One of the things that I think is going to be also part of the future of this is that the mental health or behavioral health services be integrated into community health centers. We did this last year, as you recall, in the startup in Liberty County. 1732 proposes that two sites, existing community health centers who are up and running and doing a great job, that mental health or behavioral health services be integrated into that model such that they not only provide primary health care but also behavioral health services. And we are suggesting two of those integrations. One is East Georgia Health Center, based in Emmanuel County, that serves multi-county area in southeast Georgia, and the Albany area, Primary Health Care Incorporated, based in Darcher County, that serves a number of sites in southwest Georgia. 250,000 each, 500,000 total. Item 17.4.3 has to do with disproportionate share hospitals for private funding for private hospitals. As the committee knows, these private hospitals can't access this fund through intergovernmental transfers, and the state has been providing the funds to do that. It is that fund has gone from was $21 million in state money. The governor recommends that be $10 million. In the current year, they operating, or the previous year, they're operating on $14 million. What this recommendation is that we increase that $10 million to $14 million in a supplemental. You can see that the effect of that is that the total funds, by adding $4 million, the total funds available for this go from $26 million to $36 million. So that's really $4 million state add means there's $10 million more dollars available for that purpose. Also, as the members of the committee know, the federal government is proposing, has a rule change proposed to do away with this entirely, not just for privates but publics as well. The governor has in the 08, he has a zero for that. The chair anticipates it's going to be very difficult for us to address this matter in the 08 budget, but as it relates to the 07, the recommendation before you is that we go from $10 million to $14 million, a $4 million increase. Also had discussions with people in the hospital industry about what Plan B is going to be, but that's something that we'll have to deal with as we go through. 17.5.1, if you go back to, which one is it? Go back on page 1, 17.0.3, that's funding for 3 eligibility positions. If the members of the committee recall, the department said in the CMO program they were having issues with duplicate billing because of the way the thing is done, and the effect of it is in some cases we're paying the same bill twice, maybe 3 times. They don't know how much for sure, but what those positions are intended to do is be sure that that's zero. As you members of the committee recall, the department indicated that they thought that might be somewhere around $1 million a month, and when we asked about where the savings was reflected, they said it wasn't a savings, it was a cost avoidance. I'm not sure exactly what that means, but what we take them at their word. In 17.5.01, we're showing $770,000 worth of cost avoidance for those positions. And finally, 17.9.1, composite board. The composite board is still wrestling with some rules over there to implement this, and so they're not quite ready to implement this, and this budget reflects that reality. Now, having said that, if you go back to page 1, 17.0.2, Point, point .01 and point .02, you can see there's $235 million that the governor proposes in his budget for prepaid that will roll over into '08. $235 million. What this budget suggestion to the full committee suggests is that we reduce that by $5.3 million, from 69 million to 63 million in that one line item. So out of 235 million, we're suggesting that this committee would like to use 5 million of that for purposes other than what the governor had suggested. Ladies and gentlemen of the committee, that is the recommendations you have before you. I'm glad to answer any questions. Of course, we have discussed this at length as a committee and also before this meeting today. But if you have any questions, I'd be glad to try to answer them. Yes, ma'am. Representative Hughley.
Mr. Chairman, on 17.3.2, as we start down the road of adding mental health services, is there a schedule for when we're going to do this in other areas, or how would that work?
Yes, ma'am. Again, the Georgia Association of Primary Health Care, they are the association that represents all of these throughout the state, and through their methodology, they determine the ones that have the greatest need. And in general, it's my understanding that when these services are integrated into an existing facility, that facility generally is one that has been there a while, one that has a track record of being very successful and able to do this. That's what my understanding is, and that's what this comes from. Any further questions from members of the committee? If not, the chair will entertain a motion. It's been moved and seconded that we approve this budget recommendation to the full committee. All those in favor signify by saying aye. Opposed, like sign. Thank you very much. Meeting adjourned.